Welcome to Pelvic Health Melbourne's Poo, We and Me event. What we'll be covering in our session today is toilet training, tips for those children with sensory sensitivities, any bladder concerns with your children, bedwetting and bowel concerns. So let's start by talking about toilet training and normal toilet awareness. So what is normal? There's a big range of normal, as I'm sure you are all aware if you started toilet training and talk to friends about when their children effectively went through toilet training. There's a huge range. What we do know is in general rules between 18 and 24 months, that's generally if there's no milestone issues with your child, they'll generally have some sensory awareness for bladder and bowel between that time. It talks about up to 3-year-olds because for some children, certain things in terms of their development are a little bit slower and therefore it might take a little bit longer. But as a general rule, you can start toilet awareness and steps to toilet training from 18 months. There is, as we said, some possible delay for some children, and what we're looking for is signs of awareness that they have weed or pooed, i.e. they go to a certain spot, they tell you that they're wet or dry, or they want to go to the toilet or show you any signs of interest about toileting. So signs of toilet readiness. We're looking for an interest, as we talked about before, showing an interest in anything to do with toileting, being it washing hands, dressing, or joining you in the toilet. They can stay dry for 2 hours is a good indication they're ready to start training. They can follow simple instructions, whether they be verbal or pictorial, and they can tell you or have an awareness if they've wet or soiled, soil being poo. They're the signs of toilet readiness that you can start toilet training. In this presentation, we talk about 5 steps to toilet training, and we've broken them into these parts, hopefully to assist you in any part that might be challenging. Getting ready is the steps to toilet training, getting your charts, your books, starting the toilet awareness of the steps. The next step that I want to talk about is the poo and wee awareness, which I think is missed a lot in the training, and I think can really assist some of your children to identify or understand a bit more about what's going on with their body. Getting ready at home is all about setting up your environment and toilet setup, make sure it's safe and good for your child, and then we start training. So let's go through the 5 steps in detail to toilet training. Books, apps can all be useful in the initial stages and whilst you're training to increase the cognitive focus, being the upper brain, in terms of some more awareness of what's going on with their body. So if we're training them during the day, it's great in our quiet time to be talking about what we're doing in terms of the steps to toilet training, what the steps are. You can have a pictorial book or picture cards that you can put up into the toilet, and a lot of these are available online. Just to talk them through any questions that they might have, and definitely to talk about your environment and your routine at your home. So you can personalise any of these devices, apps or books in terms of your home environment. So that's step 1, using other things to get the child starting to become aware that this is all happening. Step 2, poo and wee awareness, one of the most often missed steps. Whilst you're training, it's really important to assist your child to get an understanding that you're wanting them to feel something. And it's not something that they've brought their thought to. When they're weeing and pooing in a nappy, surprisingly, they don't often identify when they've pooed until a little bit later. And so they may not actually feel it until you bring their attention to, does it feel warm? Can you feel anything different? Now, with the development of the quality of the nappies we have, the wetness factor is generally gone. So they may get a sense of a tingling that they need to go. They may get a sense of urgency. So what are the signs that your child is showing that they might need to go? and bring their attention to it. When you need to go, I notice you jiggle from side to side, or you hold yourself there. Whatever signs or symptoms your child makes that they need to go, bring their attention to it so that they start to identify that that's their sign. So what do they feel? Do they smell anything? And it helps them to start to become aware of, as I said, what's going on through the brain. The other thing that I think it's important that's come up clinically for us is, what do they understand is happening when they go and do a poo? Some children that I work with, where the barriers have been, is that they're fearful of what's coming outside of their body, that they vaguely understand mouth in, food in and out, but that it's not part of themselves, that it's actually the food coming out. So just talking through what is a poo can be important too. Getting ready at home, the key thing that is really useful to do is actually put undies underneath the nappy whilst you're starting to train. If you're training at home and don't want mess around the house, you can easily keep the nappies on whilst you're training, but the idea is that they feel the wetness. They get a better sense of temperature and feeling whilst they're training. Summertime is generally easier because of drying time, and also that they can run around with less clothes on, so that it might just be the nappy and the undies. And it's really about picking a time when the parent or parents who are going to be involved, or caregivers, are available and have time to focus on the child. Also, to be able to lessen the distractions of other children and or pressures on when you're choosing to do this. You want to, if you can, have a good 2-week period. Ideally, the intense time is over a 3 to 5 day period, where you might be really focused on your one child sitting on the toilet every 2 hours and really focused on all their signs and symptoms. And you may be lucky and your child gets it in 2 days, but generally allow about 2 weeks to give it a really good go. So that's getting ready at home. Toilet setup. This is just to prevent the fear things that I see in clinic. To have a toilet inlay is gold for children, so that they feel safe and their bottom is not falling down into the toilet. They don't feel they're getting sucked in. Another thing is a step up, so that they feel safe and they can rest their feet down on something that's appropriate for their size. Using a potty setup is really about, are they unsafe to get up onto a toilet? Then yes, you use a potty. But as a general rule, we recommend that you go straight to a toilet seat setup if you can, rather than a potty. These are the 2 best products on the market that I found. One's from Bunnings, which is just the toilet inlay, and this seat I found on Amazon, which I really like the features because it's got an adjustable step. It's got a cushioned seat if your child has any sensory concerns about hardness, and that grey razor at the front just stops any slipping forwards. It gives them a nice foundation. Some of the children like to use that to push on or to hold with. So they're the devices at the moment. As you know, things will constantly change. But how do we start training? You've got your environment set up, you've started talking to your child, and you've taken them through some of the steps of toilet training already. So you might have done wiping their bottom, you might have done washing their hands, you might have taught them to take their pants down and step up onto the toilet. So you've gotten them ready, and when you're ready to start, you've got a clear 2 weeks in your calendar, you've got the kids minded, you're ready to go. How do we start? The concept is, we generally place your child on the toilet every 2 hours for up to 5 minutes, or to their age. So if they're 3, it's for 3 minutes. And in that time, they're just sitting there. They can use their apps, but in the early days, what we want them to do is just to sit and relax and see if anything happens. Now, you may need to sit there with them over that period, because 3 minutes is a long time for a 3-year-old. It's talking about toileting, it might be talking about wee, and you see if something happens. If it doesn't, that's okay. We celebrate the success of sitting on the toilet rather than success of action. Tends to get better toilet success. So we sit them on the toilet based on a timing schedule, and generally based on that routine, you will get success sometimes. When you're working with poo, if you want to do the two together, we generally work on a basis of when your child normally does a poo. So most children will tend to do a poo at a regular time of the day and pick that time for the time to do a time sit for a poo and see if anything happens. If not, we work with a time sit for toileting, generally half an hour after every meal. So you do it 3 times a day that you'd sit your child on the toilet for a poo, and you can coordinate that in with your wee, but most parents, and generally as a recommendation, we do wee or poo separately, just to really try and get one skill at a time. Some children get the idea and sit for both very quickly, others not so much. So we've got 2 to 3 minutes max on the toilet here, generally because most of the children that we're working with are aged 2 to 3. But sometimes I'll be working with older children and we talk about a maximum of 5 minutes in terms of sitting on the toilet. So that is our 5 steps to toilet training. Now, I've got a question time here. This is obviously a recorded version, so please feel free to send your questions to info@pelvichealth.melbourne and we will have someone answer those personal questions for you. Now we've moved away from the specific toilet training for neurotypical or normal development children, and now we're going to talk about toilet training for those children who might have some sensory difficulties or speech and or developmental. So we'll talk about little tips and tricks that might assist you with your child in the transition to effective toilet training. So let's move on. Toilet training for children with... Now we're going to talk about the 5 senses and personalising the space and safety for your child if any of your children have sensory concerns. And it's also some of these tips and tricks I actually find quite useful for most children. So let's go on to discuss these in detail. Let's talk about sound and lighting. For many children, they have sensitivities to sound. So that might be the fan in the toilet. It might be the sounds of weeing or pooing. It might be the sounds of water running. So any of those sounds can easily be alleviated with headphones, with their favourite music that they are playing whilst they go into the toilet space. Light is another thing that can easily be adjusted. Often there's very bright lights in toilets, so just having a wall-mounted soft lamp or wall-mounted plug lamp can be useful in those situations. Smell, temperature and touch. I don't tend to find many children have an issue with smell, but if they do, you can have scents, candles, VPOO spray, and bidet spray is something at Bunnings. Are all things that can help alleviate smells, but doesn't tend to come across those issues in clinic. But definitely temperature and touch, I do. So the cold seats, the hard seats, your children may not like and may be an aversion to why they don't want to come into the toilet, and those things are available. You can get heated seats. You can definitely get softer seats, and if your child has a hygiene concern, you can get disposable seat covers. So there's many resources there for your child to assist to make the environment optimal for them. Personalise the space, completely up to you. If again you're getting aversion to going into that space, make the space a safe space to be with all the things that your child likes. There's plenty of apps for toilet training. These are just a couple that you can look up. If your child is on the autism spectrum, I am a therapist who does use apps on the toilet because I personally find it's very difficult to sit children for that long on the toilet without distractions. So whilst we're on the toilet, we can use games and some of these apps to assist in the maintaining them for the time that we would like them on that toilet. And you can have timers that go at 15-second intervals so that they can do their pushing and billowing within those time frames. So apps can be quite useful to assist, and I would generally use those with more children on the spectrum or ADHD children, because the sitting time becomes a barrier and becomes a resistance point for successful toilet training. Again, questions, I'll direct you to info@pelvichealth.melbourne. Let's move on now to bladder concerns. So when is there a problem? Different to toilet training, there is an actual bladder dysfunction. What do I look for? We're going to cover normal bladder, how it works, how common are bladder problems in children and in adults, daytime wetting, nighttime wetting, and overactive bladder. So these are the most common bladder concerns that we see in our clinic and are out internationally. So how often does a child wee? Interestingly, by 2 years old, your child will generally wee at the frequency that you do, 4 to 7 times a day. The difference is their volume is smaller. So they can hold, generally by 2 years old, to the same amount, not volume, but the same time as you can. Thus, that's an appropriate time to start toilet training. How much fluid? I often get this question. So how much fluid should my children have? Generally, the recommendations are between 1 and 5 years old, 1 litre of fluid per day. 5 to 12, it's 1.5. And beyond 12, it's considered that you're an adult, the body is an adult, and 1.5 to 2 litres is recommended fluid intake. I'll allow you some time looking at this graph because I find it fascinating, and it is based on an Australian statistic. If we're just looking at the boy figures, which is the figures in blue, this is looking at prevalence of daytime urinary incontinence, showing you that at 8, we still have 20% of boys getting an occasional, doesn't mean every day, an occasional leakage, all the way up, and we're still talking, it doesn't drop significantly down until they're around 10. So 10% at 10 and then 11, 5%, and it drops off quite quickly after that. So again, quite fascinating how prevalent it is. The reason I put this slide up, because so many of my clients and parents get really concerned about the occasional wet, and just to look at the frequency, it will lessen with time. So the occasional wet after 5, we're not so concerned about. Persistent daily wetting, we are. This is the prevalence of nighttime bedwetting. So if we look at the first half of the graph, and again, let's just look at the darkened area, that's nighttime bedwetting. The other is looking at other factors. So the nighttime bedwetting, by 5, we still have just under 20% of children still bedwetting. So people will ask me, when will you start with bed alarms? And I will say to them, if it's not a bother for your child, I will generally wait till 5. Because most children will improve over time. However, I do find after 5, the child starts to become aware that they're different and that we're wearing nappies to bed and they don't want to, and it can affect their confidence. So at that point in time, or before, you can use a bed wetting alarm. They are 95% successful, and I'll go on to talk about that soon. This is something that I put in because we're a pelvic health clinic and I'm a pelvic health practitioner, and just to talk about adult incontinence. So this is again some research covering through the lifespan of women, and it's looking at that whilst under 24, the prevalence of incontinence is low, less than 10%. Around the 35 year to 40 mark, it's around 30%. Around your childbearing years. It drops off, but the average still sits around 15 to 20% of women have ongoing occasional incontinence. So just to recognise, it's a persistent problem. Yeah, it's common but can be managed. So we'll move through the questions because obviously this is an online session. Let's talk about daytime wetting. New daytime wetting. These are the questions I commonly have. My child has been dry. They've had no dramas, then all of a sudden they start leaking. Most commonly we look to constipation. Generally it's the bowel. Second, we look to urinary tract infections. If it's not that, it could just be change in routine, holiday. So they changed their diet, they've changed their sleep, or they've changed their routine, which has thrown normally their bowel, which sets off the bladder. But it can also set off the bladder. Change to family dynamics, be it stress in the family and or also new family members are other reasons. The common reason for some ongoing daytime wetting is overflow, which is the children who just get too distracted, too focused, and they just overfill. So they get really engrossed in their activity, and you can see them fidgeting because they're aware that they need to go, but then they just can't hold it. I'm less concerned about the overfillings because they are aware and we can get them to go to the toilet, and generally they don't like leaking, and so they will generally not ignore that. These are common causes of new or changes to daytime wetting. The daytime wetting is fairly easy to fix depending on the cause. We fix the constipation, or we fix the urinary tract infections via a medical assessment with your GP. We can try timed voids. If your child is consistently ignoring the urge, you can have a wobble watch, you can have lots of the Fitbit watches have alarms on them to try and encourage your child to go. Often the children will ignore this. This is the hard part. We can use a daytime, so the one up the top, the image up the top is actually a your nighttime alarm, and you can use that in the undies during the day more to alert the carer that they've started to wet, and if the child is unaware of the wetting during the day. So this is a different issue where there's no sensation, and you can alert the child that it's happened and the carer to start getting sensory awareness of wetting. Just wanted to also alert you too, there are some fantastic products now coming about for both your period and also continence undies that have great containment. These are really, really useful if the flow is not excessive, for children to feel very typical by wearing underwear that looks very normal but's got an extra absorbency for the child. So we'll move on from daytime wetting. Now we'll cover nighttime wetting. So some of the factors that cause nighttime wetting could be sugary drinks. Most common reason is a family history. So someone in the family was also a nighttime wetter, delayed nighttime wetter. It can be from sleep disorders. So if a child has a great difficulty going to sleep, they won't produce the hormone that assists them to concentrate the bladder overnight, concentrate the urine. So they have more urine storing overnight, not more than normal, but we normally can't last 12 hours during the day between wees. What the body does very cleverly when we go into deep sleep is that it concentrates the urine so that the bladder can store that urine overnight. So sleep disorders can be a big one. Smaller bladders. Some children do have slightly smaller bladders than their age, and therefore we just wait with time. And then generally we have a difficulty with no sensation. They just can't feel it, or they're really, really heavy sleepers. Definitely stress can create occasional intermittent bedwetting, and definitely constipation is another one that we would always look at. So the treatment for bedwetting, 95% successful, is the bedwetting alarms. That's that image up in the corner. You do need about 2 to 6 weeks to be with your child to break this cycle. Most children will have it locked down in 3 weeks, but you need to be dry for 2 weeks consistently before we know, or we can confidently say with success, that your child has been treated for their nighttime bedwetting. That does not mean that they may not wake to go to the toilet. or they may not sleep through. If they still produce enough urine and need to go to the toilet, the key thing is we want them to wake to go, not wet in the nappies or in their bed. So that's what we're using the alarm for, is that wakefulness. If things are significant and a problem, they'll be medically managed through a paediatrician or their GP, and there is medications to calm the bladder down, and there is potential Botox, which is not really covered in this the content, but it's actually very, very effective for overactive bladder. If your child has infrequent, now this is more the teenagers where they have infrequent bladder incontinence, the best way to find the answer to that is to do a diary and double check on the nights that they have wet, what did they do the day before? What was their bowel like? What did they drink and eat and or do that was consistent each time? You'll generally find a factor that's an irritant for your child. So let's talk about overactive bladder, which is one of the most common conditions that we see in our clinic, along with constipation. So overactive bladder is a genetic condition. It's not a problem with the child. It's a genetic condition generally. So overactive bladder means that the bladder has contracted really, really hard, not on the toilet or not near a toilet. The muscle in these children can get 3 times its normal density, and the power behind this contraction is immense. They don't have weak pelvic floors. It is all about the bladder muscle being overactive and very muscular. So that hose is turned on, and it's like a fire hose impression in terms of pressure. So you'll find that they'll go more frequently, they generally can't hold as much in, and they will always or generally always go with urgency. And they can have small losses to full bladder losses depending on the pressure of that hose. Treatment for these is generally in the realm of medical and physio treatment. So we always check for underlying bowel concerns. We use TENS, which is this little machine that I've shown you here. That's used for half an hour with your child on their leg or their back. And it's a neural stimulator or a little electrical current that helps the nerves calm down to the bladder. We go via the GP and your paediatrician to check that there's no other bladder dysfunction, and sometimes medication is also used to calm the bladder down. Then your child is just taught to hold on a little bit whilst the bladder's calmer to stretch their bladder capacity. Botox is a brilliant tool to be used on very, very significant overactive bladders. I will have some children who go 30 times a day and cannot hold. Their bladder is too strong and it needs to be Botoxed. And we can do, not us, but the specialist can do Botox as young as 7 years old. Overfilling, really common phenomenon. We call that there's a couple of reasons we talked about overfilling before for the young child who doesn't want to miss out. Then there's the overfilling based on fear. And we see this a lot. I'm sure you would relate in terms of at school, the children do not like the school toilets, so don't go. At kinder, the kinder toilets are very open, so they don't go. So therefore they overfill, and therefore that's too much pressure for the bladder to hold and the muscles to hold, and therefore they get a leak. So in working with your children, I find the best way to manage both the kinder and the school experience is really regularly going into the toilet with your child, talking about what they don't like and agreeing with them. Oh, yes, it doesn't smell so nice in here, but that's okay, normalising it. Same with the kinder toilets. Oh, is this where you go to the toilet? Sitting down, show me what you do. Showing an interest and normalising the experience in all toilets, in all environments, be they public toilets on the street, school toilets and or kinder toilets, to make those environments easier for the child to go into and with less fear. And I tend to find that breaks down the barriers pretty quickly. So let's finish up with the last condition that we see the most of here at Pelvic Health Melbourne, which is soiling overflow from constipation. These children do not feel it. And it is a mind-boggling for parents who can smell the soiling, and some of these children are 12 years old and have normal sensation everywhere else, but over time they've lost the sensory awareness to the warmth or change when they get this overflow. Generally what happens is the stool builds up, the poo builds up in the rectum. They've either held on a long time and so that stool dries out, and the rectum has an incredible capacity to stretch. It just becomes a big bowling ball or tube in the rectum, and then new stool oozes around the side, and thus they get a grainy, diarrhea-like, smeary line on the undies, which is the overflow. Often it's an impacted rectum. So we would need to investigate, look at these children and work out what to do. So why it can happen, generally it can be a change to diet, change at the school in terms of from holidays, or change with friendships at school, fear of toilets, therefore there's toilet resistance, no sensation, so they don't actually have adequate sensation at the beginning, and or they've developed this megarectum situation. Generally, a child should go 3 times a day to 3 times a week. The bowel is normal at age 12. Frequency is generally normalised by 2 to 3 also. So they tend to go at that frequency from that age. Any less than 3 times a week is a problem, or is something that we want to address and look at. So our treatment, these are the steps and things that we cover with you and your child in our treatment to fix chronic constipation. So let's talk about treatment in terms of correct sit position. So we're going to do this together at home. I want you sitting on your chair if you can, find a chair, sitting down, and mimic your normal position in terms of the toilet. And I want you to bring your hand onto the waist, and I want you to strain. So I want you to push and have a feel. Does your tummy go out or come in? The ideal is that the belly pushes out. That helps to relax the poo hole. Then I want you to bend forward so that your elbows are on your knees, like the image of the child here. And I want you to mimic the push position with your elbows down on your knees so that your poo chute is both opening, and by coming forwards, we've straightened the poo chute. So that's the importance of this poo position, which we teach to all families. So food and drink. I know this is a challenge for all kids, to getting them to eat their fruit and veg. In all honesty, we are less concerned about the food that they eat for constipation because we can get the stool soft using stool softeners in the short term, and most children with chronic constipation who've had it for many years will need to be on these stool softeners for 12 months to allow the bowel to heal. So the idea is adequate fluid to try and assist, adequate food in. So the frequency of food is more important than the type of food when we're talking about bowel movement. So I'll say that again because that shocks a lot of people. The frequency of how often they eat is more important than the type of food for bowel movement. So that's what we're most interested in. And obviously adequate hydration so that they're not dehydrated are perfect things to be looking at. We do talk to you and your family a lot about stool softeners, and we'll get you to liaise with your pharmacist to find a softener that works for you and for your child to be taking regularly that helps to soften the stool. Movement and exercise, generally that's not a problem for most children. Movement obviously assists the bowel to move. So that's why we encourage it, but it's generally not a problem for most children. Safe environment, we've talked about quite a bit in this presentation. This is significantly relevant for those with motor issues. And I just want to go back to the slide before where motor issues can be a problem with children with disability, and therefore we would use massage and other tools if your child is non-ambulatory and sitting down a lot. So there's different things that we'll do if a child is non-ambulatory, which means not walking. So safe environment we've talked about in the toilet. Time sit up to 5 minutes, but relevant to their age. If they're 2, it's 2 minutes. 3, 3 minutes. Maximum time sit. And we ideally, as we time sit every 2 hours for wee. So that's the treatment, all the treatment options we have to work with constipation and swelling. We have our question time again. Please don't hesitate to email us. Sincere thanks for listening. I hope that you were able to gain some tips and tricks that will be helpful for your toilet training with your child. And please don't hesitate to give us any feedback about how we can improve this product for you in the future. Thanks.